conference looking at it from many different perspectives. So a child will need to see an OT or a physiotherapist to assess the child's fine and gross motor skills, coordination, and the balance. Then they would also have to go to a speech and language therapist to assess speech development. Usually then an educational psychologist is involved at school level to assess learning and cognitive abilities. And then often a pediatrician is brought in to ensure that any of the symptoms are not due to a medical disorder. So it's really, really interesting condition, because it's not as though we can just go to one person and get all of the support that we need from one person. It doesn't work like that. Also, despite its high prevalence, DCD is not readily recognized by either healthcare professionals or the general public, or from what we've seen from our data as well, it's not readily recognized by the education profession. So it's a very underrepresented minority group. So the research has shown in general parental concern around children's lack of engagement with organised sport, even regularly avoiding physical activity due to their fine and gross motor disabilities. And then, since physical activity is an integral constituent of combating problems such as being overweight or obese, it is then unsurprising that children with DCD do have higher rates of obesity, elevated triglycerides, and raised blood pressure. This then may put them at risk of developing heart disease, stroke, and type 2 diabetes earlier or more often than their typically developing peers. And so physical activity is also a vital intermediary linking childhood and adolescent cardiovascular health, reducing a multitude of cardiovascular disease risk factors. And so when we have low levels of activity in childhood, we have seen that this does seem to persist into adult years, and is then a predictor of adult activity level. And so a raise in the levels of childhood physical activity, especially in children with DCD, may help to prevent or reduce a multitude of potential problems. And so for me, looking at the umbrella that is all the various different issues that DCD does represent or does present with, targeting physical activity and really understanding, getting in there and speaking to the people themselves and their families is really important work. So as we know as well, physical activity is also linked with improved mental health. And this is really important for children with DCD because they're more likely to suffer from low self-esteem, anxiety, and depression. They're more likely to be bullied in the school system. They're more likely to talk about low self-confidence, low self-efficacy. And again, as we see with the physical activity in childhood years, the mental health issues do persist into adult years as well. So actually being able to combat these things through physical activity is a very worthwhile and actually an economically smart thing to do. So our research question was, how do children with dyspraxia or DCD experience physical activity in their childhood according to their parents' perspectives? And then how do parents feel these experiences with physical activity impact their overall physical health? And the aims for the research were to employ the use of interview data to produce a descriptive exploratory account of the experiences of children with DCD using a thematic analysis framework to summarize this exploratory account into thematic categories, and then to utilize the findings to make recommendations for interventions aimed at improving physical activity for children with DCD. And as I said, as I've mentioned already, I'm using a thematic analysis which uses 6 steps of going through the data in order to break it down into categories. So familiarizing yourself with the data which has been done, we have generated some initial codes, we have been searching for themes, and so that's the stage where we're at now at the moment, where we have a number of potential themes or themes that just have not been reviewed yet. So after this, we will then go on to obviously review the themes with other reviewers to ensure triangulation, look at defining and naming the themes, and then produce the report. So everything that's been reported today is preliminary, it is not final. And the potential themes that we have sort of found so far is, number 1, comparison is the thief of joy. And so for children who are in the school system, or they're in social groups, or even among their, their personal friend groups, it's when they begin to compare themselves to the abilities of their friends, for example, or their peers, is when it can really impact on their self-esteem, and it can really impact on their willingness to engage in physical activity, if that makes sense. So what we're seeing is that there's lots of children who are engaged in groups, which is a positive thing, but sometimes because of the social element within these groups, it's actually holding them back. What we're not seeing is enough inclusion within groups, and groups that are specifically for children who might have these issues, if that makes sense. So it's when the children are in the group, they're underrepresented. They may be the only person with these issues in the group, and they're comparing themselves to children who might be typically developing, for example. It's impacting on their self-esteem. We're looking then at, parents talk about how there needs to be an emphasis on cooperation rather than comparison, or rather than competition. So there needs to be an emphasis on us all working together in a team sport. It's the competition that can actually exacerbate the issue. So it's putting pressure on the children to compete in a certain way and to do things faster and better. And it's when they're pushed to do that, they actually become quite flustered. And sometimes that can then manifest in anxiety, or in self-loathing, or in anger. So it's just this pent-up aggression, this pent-up frustration. There's also a need and emphasis for a teacher, a coach, or trainer, whoever that safe, secure adult is, to be somebody who's approachable. And so that needs to be done. Like, there needs to be a sort of a protocol that when the child meets the adult at the beginning, that it's actually explicitly stated to them that if there's ever an issue, if there's anything that you ever need, that you can always come to me. And as well as that the teacher or the coach or the trainer is actually aware of DCD, of what it is, of what it entails, and of the support that they can give to the child. If the child feels that the adult is not approachable, they tend to not want to continue with that specific physical activity. Loud noises massively interfere with activities, and when it comes to many sports, loud noises are actually part of that. So that's just something that we might not necessarily have known unless we spoke to, again, the people who are impacted themselves. We found that the parents report their children as being extremely kind and empathetic, and that they prefer to play with younger children. And that's something as well that, you know, could potentially be brought into interventions as well, that if we take into consideration the things that are preferences for these children and things that are off-putting for these children, we can actually develop a better intervention that is going to be more effective. The need for the perfect code was a really big emphasis on the teacher or the coach or the person in charge. And there seems to be a real need for a coach who is patient, but at the same time, you know, pushes the child through walls. So is very, very encouraging. So there has to be this fine balance between being patient and then also knowing, I suppose, when to push the child to strive harder and to work harder for themselves. And the last point, which is really, really interesting and incredibly important as well, is that it has to be recognized that these children are working incredibly hard, but they appear to be lazy and unmotivated. And for a person who is uneducated about DCD, doesn't know anything about it or doesn't know enough about it, you know, they can sometimes use punitive measures against the children because they feel like they're not doing enough, they're not working as hard as everybody else, because that's what it looks like, when actually underneath it all, the children are working incredibly hard. And one mother spoke about how her son they were running laps around the field, and the son was the last. He was way behind everybody else because he physically wasn't able to keep up. He with his muscle tone, with the strength, with his lack of fitness, with his lack of endurance, he was never going to be able to keep up with the group, and that was just something that he just simply wasn't able to do. When they all came back to the starting point, the trainer wanted to punish him, and so what he did was he made him run around the pitch by himself, and had everybody staring at the child running around by himself until he came back. So essentially this child was left, you know, humiliated and completely turned off that sport or any field sport afterwards. So it's like the impact that had for that child is incredible. So if we were able to increase awareness and increase that point that these children are working incredibly hard, sometimes it just doesn't seem it. but it doesn't represent the effort that's really going in.
Lorraine, you've got a couple of minutes left.
Okay, great. I'll just skip that one because we don't necessarily need that one. So the impact of the coronavirus on the health, not the wealth, of children with DCD. So we weren't looking to look at this initially, I suppose. We were looking at overall. And because of the time when we collected the data, which was in 2021, it seeped into it, and it just, that was unavoidable. So some of the things that just popped up from the data was that there was an increase in anxiety. Some of these are actually for all children, I would say, but there was an increase in anxiety among these children with DCD. So they would have high levels of anxiety anyway in general, often social anxiety in particular. But because what we did was we took children out of social situations, and then they were obviously locked indoors and they had no opportunity to be sociable, it exacerbated that anxiety for them. Most parents described how their children had put on weight. They mightn't have excess weight beforehand, but they do now, or they had excess weight beforehand and they're heavier now. Most parents also described a regression of fine and gross motor skills. So again, not that because many of these children are going to classes, they're going to lessons to improve their fine and gross motor skills, or they're going to OT, for example. So it wasn't just that they stopped improving or they stopped developing, but they actually regressed backwards. And the last theme as well was that parents had no support. And that again was true for most parents in the pandemic, but these parents in particular sort of needed support from many different healthcare professionals. So what does this mean for the allied health professionals? Say that again, Ian?
I was going to say, if you could wrap up quickly as you can, please.
Yeah, this is the last slide.
Yeah,
so there's a need for occupational therapists, physiotherapists, speech and language therapists, educational psychologists and pediatricians to be aware of specific issues children with DCD have experienced during the pandemic. That's a need now, but there's also a need for a more holistic approach between these professionals. And the second thing really is a need to increase supports now for this issue, but also important to consider the development of online support for these children. So for example, like if anything like this ever happened again, that they would have access to on-demand or online group motor skills training or psychoeducation courses around nutrition, for example. So that is the end of my presentation. I want to thank you for your attention, and my contact details are here. If anybody is interested in learning more or has any questions, they can email me at any time. Thank you so much.
Thanks a lot, Lorraine. If we could, hopefully you're going to be able to stick around and field any questions at the end of this particular session. Thank you very much for that. We now move on without further ado to the next presentation, which is from James Alexander, an Associate Enterprise Fellow in the Criminology subject area. And James will be talking about providing a safe place for young people within a violent context. Same rules apply, James. I'll give you 15 minutes, but I'll give you a warning with a couple of minutes to go.
Okay, thank you very much. I hope everyone can see. I hope everyone can see the slides. I think just I don't want to go too much into context, but just to say, I think the wider context is within kind of youth justice and looking at kind of youth safety, we've moved from what was initially an enforcement approach where, you know, to keep young people safe, we need to lock those that pose a risk up, to moving towards a public health approach. And so public health approach looks at the reasons why there's a risk to young people. So instead of seeing young people as the risk, they see young people as at risk. And within this, young people who maybe are perpetrators of violence and young people that are victims of violence are both equally seen as people at risk, because the factors that relate to young people committing these offences and being victims are often very similar. And so kind of this public health approach kind of looking at focusing on the risk factors. So the risk factors include trauma, whether that's trauma in the home, trauma outside the home. So the model we use in the UK is the adverse childhood experiences, and we know that, you know, if you've got 3 or more adverse childhood experiences, you're 50% more likely to be involved in violent crime. And so looking at that, looking at kind of schooling, how is schooling doing? Are there any other risk factors associated with kind of your parents and carers? So there drugs, alcohol issues related to them? And then kind of looking at some of the wider factors. So young people that are affected by this, what is their housing like? What is their employment opportunities like? What is going on with them at school? How can we ensure they have a good experience at school? And so youth violence now is seen in this light. We're gonna deal with it kind of in this way. So I'm going to talk today about kind of some findings from 3 different evaluations. So I've finished 2 evaluations with local authorities on their youth safety strategies, and I'm finishing up the evaluation of another project which is with Camden and Islington Council, looking at their support to families that have experienced domestic violence and have teenage or children that are going from primary school to secondary school, because we know that actually children experiencing domestic violence in the home there's a higher percentage of those young people that will end up committing violent crimes when they're older. And so I'm just going to talk briefly about some of the findings from these projects. So the public health approach has been adopted by the Great London Assembly and other major cities to address youth violence. And so the focus is on the causes, not the offence. And so within things like the youth justice system, we no longer talk about youth offenders, we talk about children, because actually, if you're under 18, you are legally a child, and therefore you should be supported, protected, and looked after, regardless of what you do. There's a big focus, as I said, on adverse childhood experiences, focus on problematic home life, and within that there's a lot of emphasis on empowering parents to deal with kind of situations themselves. And so lots of these projects are about how do we get the training that professionals have, maybe social workers have, maybe therapists have, how do we get that to parents? Because if we know it works when a professional engages a young person in this way, a child in this way, it will definitely work if a parent does. And so lots of these things are about, rather than stigmatizing parents, stigmatizing kind of what they're doing, is actually saying, well, look, you are the person that knows your child best. You're the one that they are most attached to, even if things are going absolutely terrible at the moment at home. So we're going to equip you with some tools where you can build back those relationships. The other kind of focus is on disengagement at school, which I'll talk a lot about in a little bit, and also kind of employment opportunities. When we look at kind of offending statistics, 25% of all offences carried out by or first-time offences carried out by young people are money motivated, but something like 80% of all re-offences are money motivated. And so there's a big emphasis on kind of employment opportunities as well. So I won't go into too much detail about the trauma, because I'm sure most of you kind of understand this, but it's quite a complex picture, because trauma affects people differently in terms of the timing, the type, the severity of exposure. Some people kind of talk about genetic factors will change the way trauma will impact young people. But what we do know is that actually young people that are affected by trauma, their brains are impacted differently at different stages. And so there's lots and lots of work around trauma-informed approaches. And this can be very simple. When I started doing this work, it was about trying to get sort of CAM support, sort of child and adolescent mental health service support or therapeutic support to young people, whereas now it's moved to actually how do we equip people to act in a therapeutic way. And so this can be kind of with schools, can be youth clubs, and one of the changes that we're trying to see in this this field is how we deal with disciplinary issues. So, for example, you break the rules at a youth club, and so you get banned for a week. Well, actually, you break the rules at a youth club. This might be a young person trying to communicate something's not right. So instead of banning them for a week and say you need to comply to the rules, it is about trying to then see what's going on with that young person. Similar with schools, 3 times, if you're late 3 times, that's a detention. Well, actually, what it should be in the trauma-informed approach, it should be sitting down with someone to check out why they're being late, what's going on, is their home life okay? So we're trying to move to this kind of model of working, and this is kind of just what we've just spoken about earlier. Again, within the youth justice system, we've got what we call a child first approach now, which they're a child first rather than a young offender. We don't use that terminology anymore in terms of engaging with young people. They're a child, and so how do we kind of see them as a child? And so therefore that there was a move in the kind of late 90s, early 2000s to say actually what we need to do is give young people agency and let them take responsibility for their actions. Now within this public health approach is we need to take that back, and we need to remove the adulterization of young people and the responsibilization of young people. If they're under 18, they should be under the guardianship of someone, and so therefore we need to see how we can address kind of the issues. Maybe the guardianship isn't working as well as it should. Offending behavior is normal. We should accept offending behavior as normal. What we need to do is make sure that offending behavior doesn't impact it for the long term. And the key thing that we moved from is moving from kind of a punishment and maybe a retribution and community service, people going and cleaning up streets and things like that, to a welfare. Are we addressing the welfare needs of a young person? Because if we address the welfare needs of a young person, they're less likely to commit crime in the future. The thing is, what we are seeing through the evaluation of the 3 projects is there is more understanding within organizations of the impact of trauma. However, instead of being kind of a systematic change where organizations are operating in a trauma-informed way, instead, at the moment, they're kind of putting on health and well-being projects or providing specialist short-term support. And within kind of one local authority where they were so keen to suggest to show that they had trained 1,300 teachers on how to operate in a trauma-informed way. But when we looked at that qualitatively and interviewed kind of teachers and interviewed pupils, there was no change so they said, yes, we've got this trauma-informed training, but the way that we deal with discipline, the way that we address kind of behavior isn't changing. Where there has been a change is a greater focus on secure attachment. And when we look at kind of children, younger people committing kind of knife crime, and we might not think of doing something with those kind of in nursery or 0 to 3, but we know that actually looking at this public health approach, if there's greater secure attachment in those early years, then there's less anger and anxiety in the teenage life. So therefore, hopefully, there'll be less violence as they get older. One of the key concerns is around kind of young people with special educational needs, because when we look at the statistics, they are far more likely to be a victim and a perpetrator of violence than other groups, and they're far more likely to be excluded from school. And what we're finding is that actually things are really good at primary school. So primary schools are really getting a lot better at addressing the needs of people with ASD, SEND, and other concerns. However, this is masking the wider issues, and so young people aren't getting assessed. And when they go to secondary school, there's no plans in place. And one of the things that we're hearing very clearly from workers and also parents is as soon as they get to secondary school, things start falling apart, and secondary schools are not responsive at all. And so although things are improving in one area, is actually making it more difficult in another area. One of the other things that we're seeing is within the employment kind of sector, there's lots of government programs around kind of providing work for 6 months, but there's a lot of concern again around this is not a long-term fix, and so what happens after that. And so lots of these things that we're seeing that actually is going to make some real differences are very short-term projects. A couple of things that are more long-term is there's a greater focus on early help. So this is kind of the step before social services.
James, you've just got a couple of minutes left.
Okay, thank you. And parent empowerment projects. So within the parent empowerment projects, it is about getting that specialist knowledge to parents to work with their children. However, there is still a very slow response in dealing with this. So it's leading to delays in education healthcare plans. Yesterday, I was speaking to someone from the CAMS, the Child and Adolescent Mental Health Service, who was saying there's a 22-month waiting list. So if the process has been delayed because primary schools are kind of supporting children better, so they're not presenting the needs, and then they go into secondary schools and there is kind of a concern around autism, there's now a 22-month waiting list, so they can be in year 9 before this is assessed. One of the other things, I'll finish here because I know my time is up. Lots of the things that we spoke about with local authorities, they're doing lots of things in schools kind of and in settings where they can control, but lots of the safety issues are around what happens out on the streets. And there's still a big concern around that. There's things that are being put into place around contextual safeguarding. And you might find, if any of you go to kind of McDonald's, you might find that when they're refurbished, the phone chargers are being taken out. If you go to chicken and chip shops, the seating's being taken out because they want to stop young people congregating, because that's when they know they're not safe. So although there's good progress being made in many areas where local authorities can have an influence, there's still one area kind of in the neighborhood context where there's a real concern and there's not a lot of support for young people. And so the next stage of our kind of research is to kind of look at this neighborhood context and how we can provide safety there. Okay, Ian, I'll hand back over to you then.
Lovely. Thanks very much, James. Again, hopefully you can stay around until the end of this particular session to field any questions that the audience may have for you. But without any further delay, if we can move on to the final presentation from this session, which is from Lakhita Uppal, a professional doctorate counselling psychology student, who will be talking about relational interventions for gang-associated young people's mental health. So Lakhita, when you're ready, the floor is yours. Similarly to the previous speakers, 15 minutes. I'll give you a 2-minute warning when you're approaching the end of your time slot.
Brilliant. Thank you very much, Ian. I hope everyone can hear me okay. So yes, hi, welcome to my presentation. It actually leads on very nicely from James's, because I think we're kind of talking about quite similar things here. I guess the terminology here, gang-associated young people, it's initially sort of just designed to encapsulate how sort of complex this problem is, and it's almost like indefinable. So there is a focus on serious youth violence. There's a focus slightly more on mental health and some of the trauma that James was talking about. So I'm aware that I have a lot of content in here. So I will try and get through quite quickly, but I think you will have a copy of this. I believe this is being recorded. So, and I'll also leave my email address in the chat box. So if anyone has any questions or anything, or wants to get in touch about anything, you're more than welcome. So it's almost a little bit reductionist to start with a definition of serious youth violence, because you know, as James has alluded to as well, it's a much bigger problem than just sort of having a singular sort of prescriptive definition. I've sort of provided one here just for the ease of understanding. So we're looking at the exploitation of children in organised criminal networks for the trade of illegal drugs through coercion, intimidation, violence, which includes sexual violence, and weapons. And as James mentioned, this is actually a public health problem now. And just to provide you with a few stats on how severe this problem, this public health problem is. So in 2008, 2018, so pre-COVID, there were between around 50 and 70,000 young people involved in gangs or in serious youth violence. And horrifically, sort of 22 young people becoming victims to that every single day. That's pre-pandemic. So between the years of 2019 and 2020, the number of young people murdered increased by 29%. And now looking at sort of mid-pandemic and post-pandemic, it would make sort of sense to predict the trajectory of this problem to be sort of continuing, because we have an increasing number of young people referred to social services where risk of gang exploitation forms part of their assessment. We have, of those, around 27,000 young people who are receiving no support from services. And we're looking at sort of 1 in 25 adolescents falling through gaps in education and social care. So not being able to be picked up in those primary schools or by GPs or whatever might be going on. So the problem is pretty big, and it's also complex. To sort of try and understand that complexity a little bit, I know James has spoken a lot about ACEs and a little bit about attachment. So this is sort of 3 different ways of looking at the problem of serious youth violence, and actually I think they should all be incorporated to one sort of global view. And that sort of global view is considering an understanding across 3 different levels of this problem of serious youth violence. So we have the macro level stuff that's going on. So that's stuff like the constructs of race and class, that's the prejudice that exists in society, that's like the educational institutions and how that creates sort of oppression and injustice. Then we have the meso, which is the relational stuff. So that's how young people are sort of relating to themselves, to other people, to society as a whole. And then we have the micro sort of more individual context. So what that young person might be thinking of themselves, what has happened to them that has created or formed an identity. So those sort of 3 different levels of looking at this, of the problem of serious youth violence, is reflected in these 3 different sort of theoretical models. Again, it's very reductionist to just sort of break it down into 3, but it's very much this sort of longitudinal, dynamic, and cumulative sort of risk for a young person becoming involved with, or almost, becoming groomed or exploited into the issue of serious youth violence. This is a little, I tried to sort of show in a diagram a very, very small snapshot of the complexity. I actually don't really like this diagram very much because it uses the terminology like delinquency, and it's yeah, perhaps not the right way of looking at this, because that's almost, you know, alluding to the fact that the responsibility for the issue of serious youth violence lies with that individual child, and actually that's not the sort of personal or professional sort of perspective that I come from. I think you know, young people involved in serious youth violence are actually victims of something much bigger. I think that's something that James was sort of echoing as well. So yeah, that's just a little diagram. Moving on to mental health in serious youth violence. So to understand sort of from an individual level what could be happening for young people involved in serious youth violence. So there's some sort of risk factors that are to do with mental health and well-being. So things like conduct problems, moral disengagement, rumination, anxiety, and depression. And it's thought that these might be sort of mediated through feelings of disillusionment, low self-esteem, impulsivity, and a perceived lack of opportunities. And sort of contextualizing that individual situation with something wider and more broad in the macro is sort of witnessing violence in the community and experiencing all these ACEs that sort of build to create or foster an environment that is actually very cyclical. And it's also suggested that, you know, young people might be drawn to the glamorization of serious youth violence because some of these sort of grooming techniques to get young people involved in serious youth violence and the way that sort of serious youth violence and gang life and stuff like that is kind of portrayed in music and films can, you know, be enticing to a young person, especially when we have like these feelings of disillusionment and low self-esteem. And also there's aspirations of sort of status and respect, all of which sort of overturn feelings of depression, marginalization and isolation, and belonging to something that's almost bigger than oneself creates not only like an idea of a family, but also friendship and safety. And there's also, you know, the financial security that can come from this as well. But I think the main focus of my research is actually the consequences on all of this on mental health for young people involved in serious youth violence. So the Home Office, who come from the perspective of criminalizing the young person, whereas James was sort of saying, you know, treating them as adults rather than actually the children that they are. They sort of suggest, you know, fear, anxiety, depression, and substance abuse. But I think if we look at this humanly, you know, we know that young people involved in serious youth violence are witnessing, perpetrating, and they are victims of grave violence every single day, fearing retaliation and death constantly. And you know, I can only imagine what that does to one's sort of mental health. But we do know that it's being involved is linked with high levels of PTSD. So this is the trauma stuff that James was mentioning as well. Research on trauma, however, is actually very much in its infancy. And I know that that reference is from 2013, but it still seems to be in its infancy. So we don't know that much, but what we do know is that young people actually engage in cognitive strategies that are almost like means of coping. So coping strategies that help them deal with this sort of level of violence that's going on and with the fear and the trauma that's happening. And they do this by sort of neutralizing, rationalizing, and justifying their thoughts and behaviors. So, you know, being involved in something, it becomes less severe. It's almost like a way of protecting themselves from this trauma. And we know that this kind of happens through language use, so euphemisms and slang, but also in like diffusion of responsibility. So it's almost like, you know, taking orders from somebody higher ranking in a gang or involved in serious youth violence is almost taking away a little bit of that ownership from oneself. And we know that there's a bit of victim dehumanization and blame that's going on, which all sort of suggests that actually young people are just trying to cope with the effects of serious youth violence that's happening for their mental health and trauma. So it's just a different way of understanding how trauma presents. Looking at how we can sort of intervene in this, and I think a lot of the literature that's out there talks about interventions in terms of getting the child out of the context of serious youth violence. But actually, you know, if we look at the complexity of it and we look at how it presents across this macro, meso, and micro into something much bigger than just a young person, you know, wanting to get involved in the glamorization of it, it's almost impossible to sort of make the change at an individual level without changing that which exists around them. So the exploitation, the injustice, the prejudice, and the institutional oppression. That's my perspective anyway. So what we do have is an intervention that is based on conduct disorder. So it's a NICE recommended intervention, but basing it on conduct disorder, again, it's putting the responsibility for change and almost, you know, designating fault to that young person for their individual responsibility. And so the NICE recommended intervention for conduct disorder is multi-systemic therapy. And to some extent, that does take into consideration a wider sort of network around that young person. But some research that's been done, and this is some interesting research actually, because they compared the effectiveness of MST, multi-systemic therapy, for young people who were involved in serious youth violence or gangs and those who weren't. And this was done within a youth offending institute. So these young people had already been criminalized for this. But what they found was that young people who were involved in serious youth violence or gangs just couldn't commit to the actual process. So they didn't even complete the program of MST because of everything else that was going on around them. So that sort of suggests that, you know, something isn't really working here. And this is an interesting stat that 75, again, a little outdated, but around 75% of vulnerable young people who were referred to CAMS by youth offending teams actually received no mental health and trauma-focused intervention. And I know James mentioned that the waiting list for CAMS is like 22 months or something. So it kind of shows that, you know, the mental health support that we're trying to implement, it's either not getting to young people quick enough or it's not appropriate because young people are just not engaging with it. So yes, this is just a little bit that focuses on how the inappropriateness could be because the young person is already at the point of criminality when they are offered this help. And actually, you know, I've mentioned a million times that it's something much bigger than just the issue of a young person being involved in serious youth violence. You know, if we look at police stop and search practices and actually the London Met gang matrix that was only overturned very recently, that was, you know, determined as ipso facto discriminatory and racist, you know, yeah, we're working with quite inappropriate interventions here. And for those who do sort of get the mental health support, it's not, again, it could be considered quite inappropriate what's being offered. So, you know, asking young people to stick to strict times and the days of the week and the same location that could be crossing sort of geographical barriers, going to meet somebody that they have no connection with, you know, a professional, or even, you know, a lot of young people don't even have a GP to even get to this point in the first place. So it's all sort of pointing in the direction that we need to be able to do more to help these young people and to make something that's a bit more appropriate and effective and accessible. That's an important word here, the accessibility of the support we're offering. So something that does work really well is mentoring. And you know, this was initially sort of designed as a more engaging and appropriate alternative to authoritarian involvement of professionals. And if we look at what, you know, the history of gangs and serious youth violence, or, you know, that in the first place, it is an anti-authoritarian rebellion. So, you know, almost asking a young person to go and seek see a professional, a member of authority, it's contradictory to some degree. But we know that mentoring works. Well, we know that mentoring is very popular. So this 2018 meta-analysis was done by the Children's Commissioner of over 300 mentoring programs in the UK, specifically for serious youth violence. And whilst only 6 of those mentioned positive mental health as an intervention outcome, what was sort of determined was that there's a lot of variation between different mentoring programs and also within those programs themselves. So within each sort of mentoring program, there's a lot that's happening. And it was sort of
2 minutes.
Oh, brilliant. Okay, thanks. I'll be really speedy.
Well,
So
a little bit more than that, but it's, you know, you don't need to rush through it, but just aware of the time.
Brilliant, thank you. So yeah, so this sort of meta-analysis concluded that mentoring for serious youth violence was at best sort of mixed. And there's a number of reasons why that could be. But ultimately, what is coming across is that we just don't know enough about what is happening in mentoring. We don't know enough about the process. We don't know why young people prefer mentoring. Well, no, sorry, that's a lie. We do know why young people prefer mentoring to a more sort of evidence-based or formal interventions, which is very much based on this sort of familiarity, shared understanding, unconditional positive regard, non-judgment, all of those things that make a really valuable relationship for young people that they seek in mentoring. But actually what's interesting is that a lot of those values within the mentoring relationship are stuff that we know is a therapeutic relationship. So, and that in itself is very broad. So it is things like being non-judgmental, being flexible and approachable, being open, providing this unconditional positive regard. And we know from a lot of research that the therapeutic relationship is what's most important, no matter the intervention or the way in which it's done. And we know that the therapeutic relationship can help with the mental health. So it can help with conduct disorder, depression, PTSD, trauma, all of these things that these young people are being affected by. So this sort of poses the question that if young people involved in serious youth violence prefer mentoring because of all of the macro sort of stuff that's going on, but mentoring seems to be a therapeutic relationship, what's missing there? So we don't really know enough about the process or the content of mentoring. So to what extent does the therapeutic relationship exist in mentoring? This is kind of long, but I'll just kind of leave this here for anyone to read if they want to. It's just hoping that it can make a bit more sense, because it makes sense in my head, but I don't know if it's a bit convoluted. But so it leads me on to my research, which is to actually explore how the concept of a therapeutic relationship is understood, both by the young people involved in serious youth violence and the adults they formed this mentoring relationship with. And this is essentially just so that we can begin to understand what's happening in these mentoring relationships, whether their understanding of a therapeutic relationship in this mentoring is the same as what we know from the research and literature, and to what extent that supports their mental health. Because it could be that, you know, this is the avenue, this is the way to support young people's mental health through mentoring, but we just don't know that yet. So I'm suggesting sort of qualitative research based on social constructionist epistemology, and that's very much sort of the respect for the unknown and the multiplicity of truths. So, you know, even in the way one young person may define their experience of serious youth violence is never going to be the same as somebody else's. And also it allows for that sort of context of macro, meso, and micro. And I'm going to be using critical discourse analysis, because it allows for the deconstruction of power, and it challenges injustice rather than justice. So, and it challenges social injustice. In terms of participants, I'm looking at 2 different groups from 2 different perspectives, which reflects this meso aspect of social constructionism and critical discourse analysis, whether it's the young person or whether it's the mentor. So what I'm doing is I'm looking at two groups. So adult mentors who are working with young people involved in serious youth violence, and that's happening currently. And the other group is adults who have historic experience of serious youth violence and mentoring, and sort of seeking to understand through very open-ended questions in a very informal interview, sort of what is your understanding of mental health in serious youth violence? What does a therapeutic relationship mean to you? What is working well in terms of supporting a young person's mental health? What do we need to do more of? To what extent does the macro level create inaccessible barriers to young people? That's the kind of the stuff I'm working on. It's very much early doors for the research though. Yes, and then just to chat very, very quickly about the contributions. I mean, there's I like to think there's multiple contributions of this research. So not only to the young people involved in serious youth violence in terms of informing the best possible practice and care for their mental health. So as I said, it could be suggested from this research that actually mentoring is a therapeutic relationship for young people, and their mental health needs and the trauma is being addressed through that. Or it could be that actually that's something that we need to work on, and we need to perhaps address the wider stuff that's going on in order to do so. To psychology, I think it would help inform sort of our understanding and the application of a therapeutic relationship, and how that's sort of varied across lots of different groups in society, and what that sort of means. To society, I think hopefully to start supporting the young people's mental health, so that, you know, maybe we could start addressing this public health problem from a mental health perspective. And to participants, I think from the interest I've had so far and the interviews I've conducted so far, people are really, really keen to engage, because I think people are acknowledging the effects on mental health that this is having. So people are very keen to offer their understanding to help sort of inform best possible practice. So yeah, that's sort of everything from me. I will leave my email address in the chat box if anyone wants to get in touch about anything, but thank you very much for everyone. Thanks.
Well, thank you, Lakhita. Thank you, James, and thank you, Lorraine. Some very interesting presentations. There was a question in the chat room from Rose, which I think James answered briefly. I don't know if you want to pick up more on that question, James, which is really about the bridge between primary and secondary schools as being something that perhaps isn't as helpful as it might be, which seems to be a sort of recurring theme in public services generally. As soon as people move from one particular category to another, that the services change and the transition between them is less than smooth. I don't know if you want to say more about that, James. If you're still...
Yeah, sorry, my internet dropped out for a moment. Yeah, I think what I'm seeing is that there are lots of short-term support going into kind of the transitions. So, you know, local authorities will commit to working with someone for kind of 6 months prior to them transitioning to secondary school, to 6 months into secondary school. But the staff are saying that this is not enough. It's what we have money for, but it's not enough. And I think the wider concern is that actually what the transitions workers are finding is that actually the schools will listen to, well, the parents will go to the school to say, you know, I have concerns, and they will not be acted upon. And when the worker does it, they will reluctantly do something. So once that work has been taken out of that equation, then all support will stop for that young person. So at the moment, unfortunately, everything is very temporary, and local authorities that have kind of these programs are trying to figure out a way where they can actually make them more permanent. but the money for these programs are coming from the violence reduction unit that's run by the Greater London Assembly, and they're for very short-term, kind of, it's very short-term, so it's maybe 1 or 2 years. So it's a bit of a problem at the moment.
Okay, thanks for that, James. Any questions from anybody else? Either put your hand up or type in the chat if anybody has any questions. 3 very interesting presentations.
Can I check if my microphone's working now?
Well, whoever that is, it must be, because I can hear you.
Okay, great. Hello, this is Faisal. So I had to swap computers, but I'm glad it's working now. But yeah, I've just got a question for Lorraine. So first of all, I just want to say thank you, Lorraine. It was a very interesting presentation. And just, I've got quite a psychology-based question, because you mentioned you're using Braun and Clark thematic analysis. So I'm just wondering why you chose that approach for the analysis, please.
If you're trying to speak, Lorraine, you may be on mute.
I'm not
sure.
Yeah, I don't.
I'm looking for the list. I can't see Lorraine there, so she might have dropped out.
No, she may have. She did say she was going to stay, but I'm afraid it looks as though your question may remain unanswered.
That's fine. I'm supervising that, so I'll ask later. Later.
There will be opportunities to pick that up, if not necessarily in this context.
Thanks.
There is one in the chat. Yeah, if you can see that.
I'm just swapping back to the chat. I think that's a question from Rose, or is it about insight on how parents can engage with teachers if our children are misbehaving? I don't know if you feel qualified to answer that, James, or possibly even Lakhita as well.
Yeah, I think in the first place, change the terminology. Children aren't misbehaving; they're communicating something. They're communicating that they're struggling with something, and so any kind of misbehavior at school should be seen as kind of a not a behavioural concern, but maybe an environment. The environment is not quite supporting the young person correctly. Unfortunately, you literally have to kind of almost make it so that you're more of a nuisance than the behavior of your child, if that makes sense. So, you know, if the school can just about put up with your child or exclude them, they will. But if actually dealing with you and having you hassling them all the time is harder, they will then kind of try to support you. The other key thing I would look at is making sure that we look at wider support as well. So if there's things going, if at home things are going okay and it's not at school, but not at school, then actually maybe also contact the local, local authority about it as well, because generally secondary schools won't engage with parents very much at all. It's really unfortunate, and it's only when you get a professional in. So talk to the local authority, ask for maybe kind of early help, something like that, to kind of support you. And if they're involved, the school is far more likely to do something.
Can I make a sort of question stroke observation to all three people? Because one of the themes that seemed to emerge from all three of those presentations for me was the very fact that services that were supposed to deal with a particular challenge are sort of inherently set up in terms of their values, in terms of their orientation, in terms of the underpinning beliefs about what causes these particular behaviours that are completely wrong or mistaken or unhelpful, to put it mildly. And I just wonder whether any of the presenters would like to comment on that. It seemed to be a theme that was emerging from all three speakers, that services designed to address the particular categories of vulnerable people were not set up efficiently to deal with them.
Yeah, I mean, I completely agree. I think it's quite bizarre, isn't it? That we think we have, I can only speak for myself from my own research, but we think we have accessible mental health services. That actually there's massive groups in society that just are being completely missed, and arguably the people who kind of need it the most. So this isn't just for serious youth violence and how mental health services are actually quite, well, very inaccessible, but it's also for groups like sex workers or people who sleep rough, and actually it creates this sort of cycle in society that, it creates this sort of discourse in society that people are undeserving of help because for whatever reason, that's their own choice, that's their own responsibility, that's their decision to be involved in whatever they want to be involved in. But we're forgetting to look at the bigger macro level context of what has actually led that young person or that person, whoever it is, to have that in their life. I think it's something far bigger than just the young person or the individual involved. It's the classism and racism and injustice and prejudice and everything that goes on in society that leads to that position in the first place. I hope that sort of is a good comment.
Yeah, as somebody who's been involved in mental health services in the past, I mean, I'll just give you an example of the kind of practices that are inimical to helping people. Somebody setting up a support group for agoraphobics based in a mental health centre, and then being surprised when nobody turned up because they were too scared to leave their homes.
Yeah, absolutely. I mean, I worked. Sorry. Yeah. I work, I have a couple of different placements. One of those, which is a refugee and asylum seeker service, psychology service. And at one point we were running groups for people, and it could turn out that you would have two people in these groups who were from the same country of origin, but two opposing sides of conflict. And actually we didn't get the funding for more groups, or we didn't get the sort of evidence to be doing anything different. So there's, yeah, I mean, I think mental health to some degree is a one-size-fits-all approach, and it can't be like that when we don't have one-sized people in society,
Yeah, Sam makes a comment in the chat about funding obviously being a crucial issue of that.
Yeah.
Funding for support in the school that he works in is such a low priority, and if you don't fit into the category that is deserving of that funding, then woe betide you. And I mean, just to summarise and to sort of close, I think in terms of a broader implication for these presentations and the work of people within the university generally, and I think our university and others like it is obviously coming under some kind of attack at the moment in terms of what we do and who we do it for and who we do it with. And I think this kind of work is really important in counter-attacking, if you like, that, or certainly counterbalancing some of the more extreme ideas that are coming out. I mean, youth offending, people who are subject to serious youth violence, I would imagine, are the sort of people, for example, who don't pass GCSE maths and English.
Sorry, Ian, you have Verona's hand up.
Yep, sorry, Verona, you're going to ask a question. My apologies.
Actually, that was a mistake, but I didn't realize my hands was up, but I might as well ask a question while I'm here. I've also got a lot of experience, over 25 years of experience working with children and families, particularly young people, and the issues that are just been discussed, which was great presentation, by the way. It goes beyond schools. I have worked with early help, and early help is, you know, they've got so many cases involved, they can't put the time in to give what they need to the young people. So for me, it's about looking again to the community. We have to look to the community. What about those young people who are coming from war-torn countries or don't speak the language or may have been involved in gang activities before they got here or experienced trauma and can't speak the language? So they need, there's a sense of belonging. And so, you know, there's a lot of work. It's so complex. That's why I enjoyed the presentation, because it's very complex, but it goes beyond the schools. It goes beyond early help. You know, it takes a whole community to support these children and young people. That's it.
Thank you, Verona. Perhaps we, you know, in future conferences, we might be hearing from you and your research. If you have your hand up as well, if you want to ask a question.
Yeah, that was a great presentation, and it's all round up with the same thing that is happening in communities now. But based on my experience working in school, I kind of, inside a class of 25, you can find out that it's about 15 has a special needs and all this complex going on. And the teacher is struggling, the school find it difficult to be able to fund each one of them as one-to-one in class, because that will be massive, different people working inside the class, like 5 TA or 10 TA. And based in behavior as well, I kind of noticed that some parents don't like when teacher kind of confront them that this is what is going on. They find it that you kind of pick on my child, and this is where another place they have to touch on, because parents have to contribute, because there's a lot of a child that I was working with is all over the place, is always distracting everybody, blah 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 blah. But when they send email to the parents, he feel like my son has been picked on, and sometimes the boy will not come to school for, let's say, 4 or 3 days, because the mom believe that we're not looking out for him, that he's always picked on. This is another area. It's not only what is happening. So there's a lot of issues that is going on with these things about this society with the children and whatsoever. So it's something that we're going to look at. Where is it coming from? Why is this happening? So the funding, the parents, the community, there's a lot that have to, it's something that everyone has to come together and find a solution to it, to be honest. It's a great presentation, and I really enjoyed it. Thank you.
Thank you. I'm going to have to draw this to a close. It's always the case that by the time the discussion gets going, the time is up. But as somebody once said, always leave them wanting more. And hopefully you can carry on these discussions in other contexts. Can I just say once again, thank you to the contributors, presenters for the last session, but also for the previous section this morning. Thank you very much for that, and thank you for your attention and questions during the discussion. I believe the timetable now is you have a break between now and 1:30 when we reconvene and to look at a number of presentations on health behaviours when we reconvene. So thank you very much, and have a nice lunch.